Welcome to Somerset Medical Center's Health Talk. I'm Dr. John Bucek, Director of Somerset Medical Center's Family Medicine Residency Program. As we all know, emergencies don't always happen Monday through Friday between 9 a.m. and 5 p.m. When your doctor's office is closed, where should you turn? When is it appropriate to go to the emergency department or an urgent care center? And when can it wait? Joining us today to discuss this topic are Dr. Dennis McGill, Medical Director of Somerset Medical Center's Emergency Department, and Dr. Marc Milano, an emergency medicine physician at Somerset Medical Center's Emergency Department. Dr. McGill and Dr. Milano also provide care at Somerset Medical Center's new Urgent Care Center in Hillsborough. Welcome, gentlemen. Thanks for coming and talking about the topic with us. Dr. McGill, why don't you kick it off and help us understand some of the differences between, urgent care and emergency care and maybe where those care is delivered.
Largest difference is the availability in the emergency department of the care 24 hours a day, 7 days a week. There's access to certain specialties, right at the tip of your fingers, and for those true emergencies. Urgent care centers are popping up here and there because there is a need for the not so emergent care, but the things that can't wait for 2 or 3 days to see your family doctor. Urgent care centers can be looked at as kind of mini ERs. We can handle things such as simple lacerations, traumatic injuries, facial trauma, eye trauma, and a lot of the medical kind of conditions that probably can't wait 2 or 3 days to see your doctor. And it's a much more affordable setting and much more convenient for people. So it's now become a pretty viable option for patients.
So, that also helps frame the other question. Maybe you want to take this, when should we dial 911? When does somebody say, oh, this is bad, I shouldn't drive myself?
That's a great question. And I think the response that I would like to give to that is, anytime that little voice inside you says, this is a terrible emergency, I think there may be a danger to life or limb or vision, I think that's the time you pick up the phone and dial 911. I would never want to limit people to sort of specific conditions, but things that we think of in terms of when to call 911, chest pain or trouble breathing, fainting, a sudden loss of function, a sudden loss of vision, bleeding that can't be controlled with simple pressure, injuries such as a car accident with airbag deployment, fall off a ladder or fall down a flight of stairs. I think things like that, without trying to actually limit the conditions I would advise people to call for, anything that sort of triggers that instinct, that survival instinct, would be a great reason to dial 911.
And we've talked about with other guests, if you ever feel like you have chest pain, shortness of breath, if you ever think, you can't say a word, you lose the feeling in your fingers, your face droops.
Sure.
So there's some specific conditions that we know you need the emergency department for. And you do some work with the mobile intensive care unit?
Yeah, I'm the medical director for Somerset's mobile intensive care unit. And we have 3 units that patrol, the greater Somerset County area, delivering emergent and life-saving care to our patients in our catchment area, as well as serving other hospitals.
So let's say somebody thinks, I really need advice, help, maybe a diagnostic test, but it's not a 911 situation. What kind of things are you going to be seeing at the new urgent care center?
Right. Well, we'd always encourage you first to contact your primary care doctor. Mm-hmm. If you have any questions, that's always your first go-to person. But if not, the urgent care center is going to be set up to see pretty much any other emergent condition or something, again, that you feel can't wait. We will have some of the facilities that the ER has. We'll have an X-ray suite, so we'll be taking X-rays. We'll have a little lab, so we'll be able to get some lab results right away. In addition, we'll really be staffing with specialists who do emergency medicine. Mm-hmm. So, in fact, you'll be able to see the same doc that you might have seen in an emergency department. So, we're well trained to do the laceration repairs and a lot of the things that some doctors' offices don't do and would send to an emergency setting. We can do that all, right in Hillsborough.
And one of the other important things is access. Physicians' offices have to decide when they're open, and they're not open all the time. So, right. What are some of the hours that you guys are going to offer extra access?
Well, we'll be open initially 9 o'clock in the morning till 9 at night. On weekends and selected holidays, will be 9 to 4. And again, the physician will be there, that whole time frame. The X-ray equipment will be available, the lab testing, et cetera. So, in addition, we'll also have some of the access to some of the other specialties if we needed them at Somerset Hospital itself, by way of specialty, if we needed to get a specialty consultation pretty quickly. Again, it's going to be very convenient and good wide range of hours.
You mentioned that the physician will be an emergency medicine specialist. Sometimes you can get access to other specialists. What other staff are going to be taking care of patients at the urgent center?
Well, we'll end up having very likely an RN and a technician who'll be able to do phlebotomy, draw blood testing, vital signs, and simple things. So early on, it'll be probably 3 of us in the office during the 12-hour shift.
If you want a physician to help take care of you, but you think you might do all right at the urgent care center, are you likely to wait less time there, perhaps, compared to the emergency department? Or we've yet to see, how do we know how that's going to work?
Yeah, well, traditionally, the urgent care centers will be focused on, the non-emergent type situation. So when you come into an emergency department, you have to vie for all the people that are critically ill. So your wait time's probably going to be a little longer because we don't go by the time you check in. It's really by what type of problem you have. So whereas an urgent care center is really going to be set up to be treating the customer as they arrive. And so the turnaround times are going to be much faster. And as a result, too, the cost is actually a lot less.
So yeah, I wanted to ask you about that. It's not only that the charges might be less, but I think insurance plans are starting to treat emergency care differently. Do you have any observations or viewpoints about that?
Well, I think it's true that cost containment is a fact of life in healthcare today. I think you probably see that in your practice. Clearly, that's an issue for us as well, and we want to be very aware of that in taking care of patients both in an emergency setting or in an urgent care setting. That being said, the delivery of care in an urgent care setting is much less expensive for the insurer and the payer or our customer, the client. So I think everybody wins when we're delivering quality care in an urgent care center efficiently and cost effectively. So it seems like all should benefit from this type of arrangement.
The insurance companies are likely going to be able to cover the urgent care visit. The patient's not going to be stuck with the whole bill.
Most insurance plans do have provisions for urgent care centers, don't have the same type of large copay. Inherently the ED's cost is a lot greater because they have to absorb the services that are provided 24 hours a day, 7 days a week, operating room cost, fancy CAT scan machines, et cetera. So just by the nature of the business they do, that cost is quite a bit elevated. Again, urgent care center will not have that great deal of overhead. And when most of the same conditions can be treated in that setting, insurance companies are, I would say happy, but they're willing to, cover that with much less copay.
Because the cost to them is
because the total cost is much, much less.
Good.
Yeah.
Probably much more in line with a doctor visit, regular office visit.
So let's say I go there on a weekend and you take care of me and I need some kind of follow-up care. How do you figure out who does that?
Well, what we would like to do is assemble a palette of specialists and referral physicians. Primarily, we want to send you back to your primary care physician. So if a patient from Somerset Family Practice happens into our office at the urgent care, we would refer them first back to their doctor for further advice and guidance. If it seems like something very specific and care that could only be provided by a specialty physician, we'll give them referrals from the medical staff at Somerset Medical Center for care for that problem.
And how is the patient going to know what to tell their follow-up doctor? How are they going to be able to hand over their care? Is there any doctor-to-doctor talking?
Well, we'll have relationships with all the community physicians, and we'd actually like to be a resource when they're going to be closing at 6 o'clock at night. We want them to feel comfortable that they can send their patient to the urgent care center if they feel they need it, can't wait for a 1-day or 2-day appointment. And we will either call them or we'll be able, certainly faxing their records to their primary care doc. Again, we're not looking to take care of routine blood pressure problems and things of that nature. We're looking to do the things that come up at the odd hours of the night or where, again, the appointment can't wait for 2 or 3 days. And we really do encourage them to see their family physician first and in follow-up.
And I think, John, you could probably even speak to this personally, that we're very likely to pick up the phone during the course of that visit in the ED and in the urgent care center to let you know, hey, your patient happened in here. We'll let you know what's going on, what kind of follow-up, and what time frame you think that they may need to come and see you in. So we want to keep that loop as closed as possible.
Or even ask, sometimes we have information the patient can't remember. That's
Absolutely.
very key too. So yeah, so you're going to collaborate with all the different offices and try to make sure that they feel that it's part of a group effort. You're not trying to undercut them. Okay, good.
Absolutely.
Now, we mentioned sort of when it's really serious, when to go to emergency department, when time-wise and condition-wise, maybe an urgent care setting is appropriate. Is there any advice you can give about what things can wait? People get scared, and sometimes there are things that if they had the experience before, they would wait. Do you have any opinions or advice about that?
As Marc had mentioned before, the true emergency is really in the eye of the beholder, and we would never dissuade anyone from seeking care because they're scared. They don't have the medical knowledge we do. So while it may be a simple cut in the finger, when it's bleeding profusely to the person, it's a real, emergency. So our general advice is if you think you have an issue or concern, simplest thing is certainly pick up the phone. Primary care doctors are available more than you think they are. You shouldn't be hesitant to make that call. But if you have any doubt, call 911. The dispatcher might walk you through it, or have your family member bring you to the hospital. It's always the better thing to do.
Sometimes people hear urgent care center and they get a little suspicious or nervous because there's a lot of healthcare settings cropping up, whether it be in retail outlets or big box stores, and you sort of think, wow, how good of a job can they do?
Right.
Can you help us understand that some of the differences between what you're going to start up and what they might find in these other settings?
Yeah. I think for first thing is it's a partnership with the medical center. So you have the comfort level that there are a group of specialists. It's a well-established institution. It's not just a doc-in-the-box place that opens up on the fly. It's got a good reputation behind it.
And the physicians are?
And the physicians here are going to be board certified in emergency medicine, and majority of the staff will be have worked and will work in the emergency department in the medical center.
So the same docs in
so it's the same
settings
docs
on different days. So they really know, all right, this is different. This person can't stay here. We got to go to a higher level of care.
Yeah, correct.
Yeah, that's the benefit as well, is that recognition of that problem being a little bit greater than what an urgent care center is designed to handle. That's our cue for potentially even calling 911 ourselves and saying, we'd like to get this patient over to the hospital immediately. And then we can call ahead, make sure that any provisions needed to be made can be made for that patient coming in. So I think we really offer the best of both worlds. We offer that sort of immediate treatment, but also excellent triage to a higher level of care if necessary.
And so your mind is part of a system as well as, the administrative. You know what happens to people in low levels of care, intermediate levels of care, and high levels of care. So if they walk into this setting or that setting, it's kind of the same management strategy either way. Mm-hmm. Well, that's comforting.
Yeah.
Now, let's talk about the emergency department. Is there anything about that we want to re-educate patients about severity of illness, what to expect? Somerset Medical Center's emergency department, it's still new, but there's also been hundreds of thousands of people seen there already.
Right.
And, so give us some advice for people. How should they be using that place? What should they expect? What kind of things go on there every day that you can help them understand?
Right. As I said, it's relatively new in the big scheme of emergency departments, although we're open almost 7 years now. There's been a lot of research and development and advances in emergency care in the last 10 or 15 years, and Somerset's been part of that, and they've set up the ER to take advantage of that. Two big focuses that the medical center has is stroke care and the care of an acute heart attack. The center is both certified as a designated stroke center and as a cardiac center of excellence. And the emergency department is a big part of that. So if you're coming in with chest pain and a heart attack, we have access to take you up to the cardiac cath lab within 60 minutes. If you're having signs or symptoms of a stroke, we can get you on a CAT scan table in 30 minutes or less. Decide what type of stroke you have. You're eligible to have given a medication that can dissolve a blood clot that could be the cause of a stroke. So that's a lot of the focus that the medical center has had, and the ER is part of. It's a very specialized area.
So if you're pretty sure somebody's having a heart attack, you're triggering a system, and the idea is that person is going to be in the cath lab with the cardiologist trying to open their artery an hour later.
Correct. Yep. We have a goal of having that all happen within the first 60 minutes. That's a national goal, and we're part of a group that can provide that service.
Yeah, and I'm aware that they've actually been meeting the goal with dozens and dozens of, I guess we call them code MIs at our hospital.
Yep, we have a whole process set up. It actually starts in the ambulance field. If Dr. Milano gets a phone call from one of his medics about a case coming in, they can send us the EKG, we can make an interpretation, and we're calling the cardiologist even before the patients arrived in the building.
It's really utilizing the technology to its fullest extent to benefit the patient.
Yeah, and I think there was a bunch of patients that would get clot busters in the past, but they now understand those patients actually belong in the cath lab also, so it's being utilized by more heart attack patients. How about, give us some details about the stroke and the interaction with neurologists, and how does a patient get evaluated by a neurologist with a stroke after you do your evaluation?
Okay, well, initially that patient may either present, I think the big thing to think about is how the patient is coming in. And just sort of another disclaimer for the 911 system and also for our Somerset EMS is that is another condition in which time is so critical to survival and viability, so that we want people to get into the hospital as quickly as possible with signs and symptoms of a stroke. So you had started to mention before slurred speech, drooping of the face, weakness or numbness in an extremity. All of those things should sort of activate that chain of survival. That being said, once a patient presents to us, whether it be by the ambulance or through the front door, we're activating a code stroke. So much like the code MI, a sequence of events is immediately kicked into place once that phone call is made. Technicians are called to get down and bring the patient to the CAT scan. Blood work is being done. All of this in parallel, while at the same time, the neurologist on call is being paged urgently to get back to us so that they can come and help guide the care of the patient, which frequently also happens within a very, very short time frame. And again, our goal with the TPA administration, which is the clot buster drug used for stroke, is a door to needle about 30 minutes. And we can get neurology consultation virtually instantaneously, at least by phone, to get initial guidance, and then we can get the neurologist in there very quickly to do the full evaluation and ensure that that patient gets the most expeditious care possible.
So code stroke, code MI are both nationwide standards for timing, and the care is the same as heart centers and brain centers all around the country. I mean, that's where these standards come from.
That's a process that we've really sort of subscribed to that is a national standard, yes.
And sometimes even just by talking to the medical squad on the way, that's the kind of protocol you're going to be engaging. There's another named code at our hospital, Code Chill. You want to just tell me a little bit about that? You guys supervise that process too?
So Code Chill is also known as therapeutic hypothermia. And what was learned from experience with drowning victims many years ago was that if their heart stopped during the event of drowning, they seemed to survive better if their body temperature was lower. So extrapolated from that data was if we were to actively cool people after a heart attack and then subsequent stoppage of the heart or a cardiac arrest, they had better outcomes from a neurologic standpoint, meaning when they woke up, they functioned better. They had less disability. So what we've done is we've initiated a program with help of cardiology and other specialties to start cooling patients in the field, still in the ambulance, who have recovered from a cardiac arrest. So the paramedics attended to the patient, their heart was stopped, either by electricity or medication, the heart was restarted, at which point we start to cool that patient by giving them ice cold IV fluid and packing their body with ice packs. We have other more elegant ways of doing it once a patient arrives in hospital, but this has been shown fairly conclusively to improve survival of cardiac arrest as well as outcomes once someone recovers from a cardiac arrest. And we've been doing that at Somerset Medical Center for over 3 years now, and our numbers are excellent.
Wow, so those are some of the more dramatic and compelling kind of care that starts in the emergency department. How about some of the other, still urgent for the patient, but, the more usual kind of care? When somebody comes in the emergency department, what's an average day like for you guys?
The average, there is no average day. I mean, in one sense, there's an average day. In the next sense, you never know what's going to come in and walk through the door. And, obviously, an emergency department is set up for everything from a hangnail to having to deliver a baby. And that's, again, one of those differences between what can you do in an emergency department versus an urgent care center. In an emergency department, we can deliver a baby, we can get you to the operating room, we can bring you to the cardiac cath lab, stroke center. And in the urgent care center, we can do pretty much everything else. So the average day depends on the time of day and which day of the week. You never know, and we're prepared for all. The good part about that urgent care center is those same group of physicians who's prepared for anything in the ER is going to be the same group of physicians who can take care of anything that walks into the urgent care center.
So how many patients do you see on a, let's say, a typical day at Somerset Medical Center Emergency Department?
The daily volume is anywhere from 150 to 180 patients a day, spread over the 24 hours. There are times when there are bolus patients or busier times.
Like the flu season.
Like the flu season.
Hopefully is ending.
January was extremely busy for us throughout the state, in fact. We had volumes that were just unprecedented due to the flu and other respiratory illnesses. We see funny trends like the days after holidays. We are busier. Why is that? The patients kind of wait on the weekend. They're a little sick. The last minute they call their doc, can't get an appointment. Where do they go? They come to the emergency department. So, Mondays, day after the holidays, interestingly, are some of our busiest days.
And I guess weekend warriors,
yes.
People who try to exercise for the first time in a month and then
yeah, absolutely. We see some seasonal bumps in certain types of visits. Hopefully the weather's going to change this weekend, and we'll start to see the people that are doing the yard work and all the athletes of the weekend, warm weather, going to play some touch football. So we'll get some ankle sprains and all sorts of good stuff.
Yeah. Just an opportunity, based on what Dr. McGill said, too, is to speak to any children that may be watching or the parents of children that may be watching is, kids will be outside now running around. They've been cooped up all winter. They can't wait to get on the bicycle and just tear around the neighborhood. Wear your helmet and be safe. Watch for cars. We see lots of fairly serious injuries related to children riding bicycles in those first few warm days when they're just so happy to be outside but not really paying close attention.
How about skateboards?
Actually, scooters. The advent of the Razor scooter was probably one of the best things for our careers because the injuries that we see are so rampant.
And that's face and hand injuries and
largely
wrist fractures,
yeah.
facial abrasions.
Yep.
So wear your helmet, wear your wrist guards, be aware of your surroundings.
Yeah, be aware of your
surroundings.
Absolutely.
And and I think I anticipate some of the same kind of activity because I just feel like this winter is longer and colder, perhaps.
Yeah.
So I think people are going to feel really a great sense of wanting to be in the outdoors soon. So just for us one more time, the days that you're going to be available that maybe some doctor's offices won't be available once you are down at Hillsborough Urgent Care?
Yeah, so we'll be open from 9 o'clock in the morning to 9 p.m. Weekends and holidays will be 9 a.m. to 4 p.m. That's how our first couple of months is going to go. And if we continue to get busier, we'll continue to expand those hours if we need to.
And they might even meet one or the other of you two if they wind up at the urgent care center?
There's a fair chance they'll be running into the Dr. Milano or myself, or a couple of other staff
members. Up at the big house, right?
At the big house, yes, yes.
So any final thoughts or advice for our patients as they try to figure out those scary moments in their lives, as they try to figure out, something happened, I'm afraid, what do I do?
Well, I think the first answer is ask yourself, do I think there's a risk of life or limb here? Clearly at that point, 911 is the option to call. If not, if that voice is just a little bit less intense in the back of your mind, I think I have a problem, but I don't think it's that bad, I think the next thing to do is to call your doctor. Unfortunately, not everybody has access to a primary care physician to call, so we would always say, err on the side of caution, come to our urgent care center or come to the emergency department so that you can get the problem checked out promptly.
Do you ever take phone calls at emergency, patients wondering? Where do I go? What do I do?
The triage nurse and the nursing staff screens calls through the emergency department, and people call in. They'll actually end up speaking to a nurse.
And they sometimes help them sort out
Yes.
what a good
Yep.
best
They'll
first
help
place
sort
of
out
care is.
to, yes, you should come in. Did you talk to your doctor first? And you know, we always will end the conversation by, if you feel you're concerned, we are always open.
So it's a lot of good information. So we talked about the new urgent care center in Hillsborough. We talked about some of the specialized care in the emergency department. Good advice for maybe trying not to have an emergency department visit. Good advice for what very scary things should cause you to come right into the emergency department. Just want to say thank you to both you gentlemen for coming and sharing your expertise with our audience, and you know, good luck with the success that you're going to experience down in Hillsborough.
Great.
Thanks for coming on the show.
Thank you very much.
Thanks, John.
This concludes today's episode of Somerset Medical Center's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral number at 1-800-443-4605. For more information about Somerset Medical Center, you can visit online www.somersetmedicalcenter.com. Thank you for watching our show.